I used to feel like I worked backwards. Turns out, if the SI joint is cranky, the piriformis goes into spasm because it's doing you a favor to try and lend stability to that joint. So after we release this and normalize and get the SI joint free, then the piriformis is going to release that much better. So I like to make the SI joints happy first and then come back and work on piriformis.
Yeah. I do the same thing. I always do joint, then muscle, then restorative exercise. That is the process that we take in Renew. And the reason why is exactly what he said. When the pelvis is out of alignment, when it's not moving properly, when the lumbar spine is not moving properly, when your hips are not mobile enough, when there are joint dysfunctions, the muscles try to compensate for you, which is why, by the way, when you come in, you're like, yeah, kind of grew over the last few months and now it's 6 out of 10 or whatever. It didn't happen overnight, right? Unless you actually twist your knee or throw and hurt your shoulder in that moment. The reality is most dysfunctions happen and you have pain, but your brain doesn't know it because your spinal cord actually keeps it a secret from your brain. We call that gating. The spinal cord's job is to gate pain signals to your brain that aren't important enough. And so what happens is that signal goes through your spinal cord. The spinal cord does its own job and it says, well, let's tighten up those muscles and see what happens. The muscles tighten up, the pain signal comes back down, and your brain is never none the wiser. And so you actually feel normal. But then a couple months later, the spinal cord and the muscles, they're working really, really hard. They're getting really, really tight, and they're doing some things, and they're getting overworked because the mechanics are off. And then eventually the spinal cord goes, man, look, I can't deal with this anymore. I'm going to tell the brain. And then you wake up one day and it's like 5 out of 10 pain. Where did the heck did this come from? Well, it came from like 4 or 5 months ago. And so really what we need to do is we need to address what happened then and then bring it back. So you start with joint manipulation, joint mechanics, and then we do some soft tissue work to kind of calm the muscle down, saying, hey, muscle, we know that you've been working really hard. Let us take over. We're going to take care of this stuff. And the muscle calms down, and then the pain comes down with it. Once that's the case, we want to do the restorative exercise. We want to teach the body how to activate appropriately again. And then by that time, you're mostly out of pain. And I will tell you that the restorative exercise part is one of the most important parts. You guys, the patients, love the manual therapy because you feel good. But if you don't do the restorative therapy and then exercises afterwards, what tends to happen is that you can fall back into some of those old patterns that promoted your pain to begin with. So we don't want that. So it's probably the more important side is to do some of your exercises as you're being discharged from therapy. Well, at least from Renew, because that's how we do it. We don't necessarily count reps for you. I think that's a waste of time. You're a smart person. Just count your own reps at home while I go do my specialty here in the clinic and make the environment really good for your body to recover.